Welcome. My name is Corinne Waldow. I'm the Senior Director of Economic Vitality at the Boulder Chamber. I want to thank you for joining us for the October 21st, 2021 session of our cross-industry update and basically resource session for our COVID-19. It's designed for businesses cross-industry. Today, you just get Lane Drager from Boulder County Public Health and myself. I know we've had other speakers in the previous weeks, but it's just the two of us today. I will say that we continue to draw large numbers. I was joking with a colleague the other day that all you have to say is we're having a Boulder County Public Health COVID-19 update, and I'll get large numbers because I know a lot of people are going through Zoom fatigue, but I don't think it's happening on these webinars still. We still get lots of questions. We still get lots of attendees. We get a lot of questions between sessions. So I appreciate the engagement. I appreciate people asking questions and getting them answered. We will start off with Lane, and I guess end with Lane because he's our only speaker today, but we will take questions in the Q&A feature. I can take them in the chat. It's just a little bit harder. We also can't download them for Boulder County Public Health later on if they're in the chat. So please put them in the Q&A if you can. I cannot unmute you because of the numbers that we do get. Lane, go ahead and take it away.
Thank you, Corinne. Thank you all for joining. I'm going to run through our surveillance information that as of updated Tuesday morning, so a couple of days ago, but should be fairly accurate. So here's kind of where we're at in our trend on cases. The 7-day cumulative case rate is 151 per 100,000. So again, you're going to see little differences depending on when data is downloaded, but this was our information that one of our statisticians shared on Tuesday. So you're again seeing we're not sure if we're actually reaching a leveling off point. We've kind of just bounced around now for the last many weeks, so haven't really sustained a strong downward trend. We've seen some increases from week to week and then some decreases. So again, hoping to actually see that trend just continue and drop. Here's kind of what things look like. Again, you're seeing a little bit of an increase actually from last week to this week, even though that line looked downward, it actually is bouncing up from last week. And really that trend is happening across the whole Front Range and of those counties that are monitoring, except for kind of Grand, Clear Creek, and Douglas have a little bit of a downward trend, but still seeing very high case counts in those counties. Something to add while I've got the map up, so Larimer has always been fairly high. They have recently put a mask order in place. So I know that has been a concern for businesses, that people are potentially going to neighboring counties because they don't have those orders. And Larimer, at least now, is in a place where they're adding that mitigation strategy. Our case trends, bouncing around. This one maybe a little bit artificial, but actually it's influenced always by the smaller amount of people in that age demographic. So you see that jump and spike in our 75 plus, and that's because the case rate, or the rate jumped from 38 last week to 52 cases this week, and the overall number of residents in that age group are smaller a representation than some of the other age groups. So there's less people that actually are in that age group. But anyway, that's still a concern. We have had some long-term care issues, so that continues to be a concern because we know that a large number of the deaths have been in that age group. Tracking across race and ethnicity. So again, we see where we're at specific to our Hispanic Latinx community. So in the last 7 days, 23% of our cases have been among Hispanic Latinx. And again, 14% of our overall population is in that demographic. So still seeing overrepresentation among the Hispanic Latinx community. So that continues to be a big focus area for our vaccination efforts and outreach efforts. The other sort of misrepresentation based on population is Longmont is still seeing an over representation of our cases. So 41% of the cases are in Longmont, 24% in Boulder, and the actual breakdown, 120 cases in the city of Boulder. We were at 110 last week, so a little bit of a jump there. 209 cases in Longmont, and there were 206 in the prior week. 98 cases in Lafayette, Louisville, and Superior. We were at 108 last week. And then the rest of our municipalities and unincorporated county were 83 cases, and we were 86 the prior week. So again, seeing an overrepresentation of cases in Longmont compared to its overall population. So Longmont is about 29.5% of our county population, but again, seeing 41% of the cases. So that is also, in addition, our focus area. Just to give you some additional info on the breakdown of what's happening within our region, hospitalization wise. So ICU bed availability decreased to an average of 10%. So again, we do not want to see that. So it's down from 11% last week. The staffing continues to be a challenge as well. And then the hospitals are reporting, just that shortage. So that continues to be our really focal point, as we've had main goals, one of which is to make sure our healthcare system does not get overwhelmed. And again, we're continuing to see many of them get further and further strained. And I think that's one of the reasons Larimer has added their effort to put an order in place. The number of cases, this is that same tracking, but it also is showing you what our capacity for case investigation and contact tracing is. So we still are in surge and do not have capacity to handle the volume of cases that are going on. 19 deaths since May of this year, and we are heading into the fall, so we are concerned about that fall surge. So if you look at what happened last year, we saw near the end of October and certainly into November and December a pretty significant surge. So that gives us, again, concern if we see another surge this year. Our testing and 7-day positivity, unfortunately, continues to trend up, and we've seen that across the state. So we are over 5%. We're at, I think, 5.1% positivity rate, which is an increase from last week where we were at 4.7. So we continue to see that rise. We're averaging about 1,890 tests per day over the last week. So a little bit of a drop. We were over 2,000 per day in the prior week, but still seeing, a fair bit of testing happening. Vaccinations, we are at 69.5% of our total population are fully vaccinated, which is 78.4% of the eligible population. So still seeing that lag. I think we're also seeing a little bit of a leveling off in Boulder County, whereas compared to the rest of the state, whose trends are still a little bit stronger on the upward, and I don't think we are not leading the vaccination rates anymore. So continues to be a challenge. We know that to get to herd immunity, especially with the Delta variant, we need much higher rates. So we are very much looking forward to the approval for the 5 to 11 age group, because that will hopefully address a significant portion to jump us up. But we know we still have a number of folks that are choosing not to get vaccinated, in addition to the ones who may not medically be able to. I wanted to share some of the common problems that our staff have seen with some of the businesses, and it's really around signage. So ones that are either not placing them, or if they're having challenges with patrons, vandalizing or removing them. But then in some cases, there's incorrect signage. Some people are still posting signs saying you need to wear a mask if you're not vaccinated. So again, unless you're in the vaccine verification program, you need to make sure that the signage indicates that all folks that are entering the business have to be masked. So it is not a choice based on vaccination status. Only if you're part of the vaccine verification where you have those high rates of vaccination can you now have everybody unmasked. So it's important that people see that. And again, some businesses saying that they were unaware of the requirements. So it's unlikely that those folks are on this webinar if they, but again, just some of the things that we're seeing. I want to also share kind of where the vaccine verification program is at. So we've had 248 applications, and that represents 235 businesses. So some businesses have either one-time events and have had multiple applications. So that's why those numbers are a little bit different. 187 of those have already been approved. And something that we really want to encourage is folks to look at, again, the vaccine verification, even if it's not something that is a huge incentive, especially let's say like in the restaurant where your patrons are going to be unmasked regardless of vaccination status. There's multiple reasons to do it. It's going to be more protective of you. Being in the vaccine verification program as a restaurant also would enable your staff to be unmasked, which they cannot be right now. And we've seen success in our peer areas. So Denver has had restaurants who have offered a vaccine night and have seen that to be their most successful night. So there are a lot of people in the community who are hesitant to go out, and this is a way to help drive additional business to you. So we would really encourage you to look at vaccination days or nights. So it doesn't have to be an all or nothing as part of that vaccine verification program. You can look at times of day and think about setting those aside where you would require the vaccine.
So Lynn, can I tell a story real quick? I attend a yoga studio in town who is a vaccine verified program for certain classes. And I went to one of the classes and I haven't seen that class, even when we had no masks, even when over the summer masks weren't required. I haven't seen that class as well attended as it was for the first time that it was a vaccine verified class. People that haven't attended yoga in 19 months are back because not only they didn't have to wear masks, but they were in a room full of people that were vaccinated and they felt safer than they have doing yoga in a long time. So not going to say that that's for everybody, but I was shocked. I was in shock with the amount of people that showed up for the class, and they had to cap it. But just that was another story or insight that I saw.
Yeah, and I think that's great. It's important for folks to consider that I know that there's been information shared with us that people are losing business to peer counties where they aren't requiring these things. But I know that there's a whole set of folks that are not going to any of the businesses because they're concerns. And so these can be ways to really encourage them to come back and give you patronage. Something that I know was shared a while ago, but our folks that are managing our emergency management have really desired to get feedback. So they're building an after action report and review of all the efforts that have happened during the pandemic. And they would love to get feedback from the business community. So this is a link, and Corinne can share that again. I think she's sent it out multiple times already, but I know that everyone doesn't want to spend time on things that they don't see a lot of utility, but it does have value. It really can give our folks best practices and things that need to be improved as we continue on with this pandemic, but certainly as we have future issues and for future disasters in the community. Again, hopefully we don't see anything for quite a long time, but we know fires and floods and all sorts of things still impact our community. How we can build our responses is very important. And as we've done, I think, on every slide. We have a lot of links to resources to really help you get the information you might need. This is where you can find a lot of the current data on what's happening within our county as well as on a broader scale. So as you need information, definitely please go to trusted sources. And with that, we can definitely move to questions.
Great. I am about to post the list. One of the questions was, what's the list of companies that have been verified in the vaccine program? So I have posted the list of companies. It was also in the email that I sent out. So those are updated on a pretty regular basis. They don't get them updated every day, but they are updated on a pretty regular basis on the website. You can go in, it tells what city, what area they're in, and who has been approved. So that is there. Someone said that they wanted to go back to a health club that without a mask and wanted to figure out which ones were already approved. You mentioned another county that has indoor mask restrictions. Can you remind everybody the counties that have indoor mask mandates, universal indoor mask mandates beyond the school ones?
So Larimer just put an order in place. I believe Eagle County has one. I think it's, San Juan Basin or San Miguel County. So I think Telluride area. And I'm not sure if Pitkin has one or not. So there's a few counties that have the kind of full indoor mask, and then there are quite a few that have school-based, child kind of care-based. I think that's much broader. I know within the Front Range, Jefferson County, Denver, Broomfield, and Larimer. So a lot of them have the school, but those are the ones that I think have ones that are similar to ours. Jefferson County has one for municipal buildings, so both county and city level municipal buildings, but it has not been extended to businesses at this time.
So Larimer's went into effect yesterday, so it was October 20th, and that doesn't include Estes Park too, because Larimer is the governing county for Estes Park. Okay, so do you anticipate adding capacity restrictions?
I don't know if that will happen. I certainly hope not. I know Colorado is slipping. We're starting to see higher counts than other parts of the country. And we certainly don't want to have that happen. But at this time, there has not been a proposal for a public health order to do that.
All right, I'm going to ask a few testing questions. Is Boulder County offering any free testing kits for businesses to give staff who are unable to get vaccinated or choosing not to?
I don't think we have at-home test kits. There are free testing sites available, but we are not handing out at-home test kits.
But in the email I sent out yesterday, the state is offering an at-home Binax testing kit distribution program. I will say capacities are limited on that. So you may put in an order, you may get it, it may take a little while. So in the email I sent out yesterday, there is an at-home testing kit ordering site. You can order them through the state of Colorado. And then the free sites are the Fairgrounds, Stasio, and then the COVID check sites of Centaurus and the Innovation Center and a few others, all on Boulder County Public Health's website. And then we do have access, not to free, but if you're finding that you need bulk access to tests, whether they're PCR or some of the other types of tests, and you need bulk access to them because you happen to fall in some of the federal legislation, just email me, because we do have some local labs that do have authorized tests, and we could get you access to ones that you'd have to purchase if you're not able to get access to enough of the free testing.
If you have folks that are considering doing those home testing, we would encourage you to get someone that can help proctor those, so people understand how to do the tests, and so they make sure they have good valid tests and they're not they're not just doing testing and it's not valuable information for you. So, but yeah, CRIN has a lot of those resources that I think she's already shared.
Yeah, so often like the binacs are sometimes more valuable when you are symptomatic, for example, in a PCR. So there's different types out there, but you still have all the free testing sites within Boulder County. They're just not rapid tests. Okay, so for a situation in Boulder County where maybe you have part of your office being renovated and the entire job site is indoors with no windows open, who is in charge of requiring the renovation workers wear masks? The office or the construction workers or the construction company?
That's a good question. I think the employer of whoever the employee is ultimately responsible. I think it's a good idea if that company or whatever the owner of the building is, whoever they've hired, to make sure they're sharing that with the people that they're contractors. So there's a little bit of a mutual, but ultimately I think the employer is responsible for their employees.
Right, so we've gotten some notes recently of irate, angry. I mean, it's not just recently, we've heard about this since the beginning of the pandemic. People that don't want to wear masks, that threaten to sue, I can't wear these. What steps does a business need to go through as far as when they are front facing with the public, when it comes to denying service to somebody that's not wearing a mask?
We've shared a sample draft of how you can approach that. So there are talking points and a way to go through explaining the mask order and what's needed. So ultimately, if somebody is becoming aggressive and violent, that is a point where potentially law enforcement may need to get involved. But really the expectation on the businesses is that you have the signs posted, that you are addressing patrons who aren't wearing masks, but not to get into any kind of physical altercation. If people are becoming aggressive and violent, that's not an expectation of businesses. So again, if people are acting that way, the best recourse would be to reach out to law enforcement at that point, because that's not acceptable for any reason, let alone when you're trying to ensure everyone's safety.
All right, so do you just see the sample script at this point?
Yeah.
Okay, so we sent this out yesterday and it's in English and Spanish, but this is the sample script and it's been revised. And within the sample script are links to the State of Colorado Civil Rights Guidance for Public Places, as well as example reasonable accommodations that could be offered. And then additional sample workplace script for additional reasons, despite this happened, or they put in a lot more signage that you can use, where you can reach out for concerns and so forth. So the script has been edited since its original edition. And it now has links to some of those resources, including that civil rights guidance and the reasonable accommodations. I know I've had to send that a couple times this week, and I did send it out in yesterday's email.
And if a business isn't experiencing something like that, that enforcement is not going to happen on a business because of a patron who's belligerent like that and threatening to sue you because you're telling them they have to wear a mask. Because that's not exactly what you're telling them, is that if they want to enter the store and have patronage that way, they do need a mask. If they are refusing to wear a mask or unable to wear a mask, they can have carryout service, depending on what your business does and how you function. There are accommodations that you can make. So it isn't necessarily that you're refusing them service, but they just can't walk around your business without a mask. That's not okay.
And one of the businesses I talked to this past week has an online store, so you can purchase everything that's in the store online too. So, can you go back to the metric of how many cases per 100,000 we need to be under in order to no longer wear a mask, and how long we have to be there.
Yeah, we need to be under 50. So
You're kind of going in and out of a wind tunnel. So it sounds, so if you could say that number again, because you were like, we have to be under
we need to be under 50.
50.
50. We need to be under 50. So we're about 3 times that right now. So we have quite a ways to drop, and we need to sustain that for 3 weeks before we would remove the need to wear masks. So we've got quite a bit of work to do.
So the metric is the 50 per 100,000 being the yellow on the CDC tracker. And we have to be there for 21 days, and we're still in the red. We're 3 times that. So you're not even at the point where like, okay, we're getting close. We're going to start the timer. We're still in the masks for a while.
Yeah, and again, very concerned about this fall, seeing things go the wrong direction. You know, we had significant outbreak last year, significant surge. So that's, again, the concern is if there's a fall surge, especially coupled with the potential for flu. Although, again, the mitigation strategies are the same. There's a flu shot, it's available. We encourage people to get that. Masks are effective at preventing the flu spread as well. So those are similar mitigation strategies.
I've heard a lot of people talk about, oh, I'm waiting my 14 days between getting my booster or my vaccine and my flu shot. Do you have to wait, or can you get those at the same time, or is there a waiting period for that?
Yeah, there isn't any co-vaccination restrictions, so you can do that. Just because some people end up not feeling well, I think that's fine for people to have a little spacing so they're not doubling up on vaccines, because some people are experiencing that immune system boost, so feeling achy and not well. So it is fine to separate them, but we encourage you to get that flu shot as soon as you can if you haven't gotten it. Hopefully most people are well past getting their COVID vaccine, because that's been widely available for a long time now.
I've seen long lines at Walgreens for vaccines lately. So I'm hoping those are for the flu vaccine. Well, I'm hoping that people are also getting vaccines. Booster shots. There is not a booster shot yet for J&J. This is one of the questions that came in, correct?
No.
Can J&J get the Moderna or Pfizer booster shot?
I don't think there's been any.
I still can't hear you again. You're going to need to get closer or something.
Yeah, nothing has been approved for mixing vaccines. So if you got J&J, you would need to wait until there's an approval for the J&J booster.
Yeah, we had a question last week that we never covered, that someone was mentioning someone had the J&J and they got a Moderna and got really sick. Is this something that's normal? And the answer to the question is there's actually not been approval for the mixing of the vaccines. Who at this time is eligible to get booster shots?
I think it's pretty broad. It's going to be based on both age and then sort of those underlying health conditions. So if you have underlying health conditions that qualify, I think it goes down to even 40, or it goes to a pretty low age. So there's a pretty broad group that is possibly eligible based on your health conditions. Otherwise, I think 65 up without any other underlying health conditions are eligible.
So someone was mentioning that the FDA is authorizing that they're looking at Moderna and J&J vaccine boosters, and that they're looking at the mixing of it. And in the chat, in an article from NPR. So if somebody wants to look at that, that's available. According to the mask mandate, let's say you have a gym and you have a cardio area and a weight room area that's separated by 20-foot hallway. If there's only one person in each room, would they be able to remove their masks?
There's a door, yes. So if it's just a hallway and all an open shared space, then no.
Okay. If let's say you have a gym and you have one of those cardio rooms, and there's only one person in that room and the door is closed, the person can remove their mask. Or you have the basketball facility and only one person's in that basketball facility and the door is closed, they can remove their mask.
Yeah, it needs to stay that way. So it can't be a space where anybody could enter at any given time. So would need to be dedicated that that's the only person who is using that space versus it just happens that only one person is in there right now. So just to be clear on that, that's very different than someone's office where they're not expecting other patrons commonly use that same space.
Somebody else just put an article in that yesterday, it was actually yesterday, that the U.S. Food and Drug Administration authorized booster doses for Moderna and Johnson & Johnson Wednesday, and that they could be used as a booster in a mix and match approach. So I guess people need to do some research on that if that's a recent update, and we can come back to that. So I appreciate the articles. We'll come back. We'll come back on that. All right. Is it correct that offices are checked for mask mandate compliance? They're not checked for mask mandate compliance unless there's a complaint?
Typically, we aren't going out to just inspect every business to see if they're masking or not. We're really driven by complaints.
Now, if you are a vaccine verified facility, or what verified vaccination, one of those facilities, is there a possibility that somebody could come in and check your record keeping and your vaccinations, that you're checking vaccinations at the facility?
Yeah, I mean, it's similar to any business. If we had concerns, typically complaint driven, we're not going out to just audit every single vaccine verified business. There have been a few where some of the policies didn't fully align with what we needed, but outside of that, we're really focusing on if what you've submitted we're expecting to be true and you've already attested to that. And so until we get complaints, we're not going to just proactively go out and inspect every facility.
And then again, your first tool is education. So if the business didn't know that they had to change their sign, first step was to help them find the right signs. Or in some cases, the order is just written that you could just write. I mean, I've seen some put in like Sharpie on the big window, mask required to enter, as long as that's written someplace on before they enter.
Yeah, vaccine verified should be very aware of what they've applied for and what they're doing. So it's a little different than a business who, is not complying with the mask order. This is a business who specifically indicated they've put in additional measures. And if they are not doing any of that, that would not necessarily start with just education. They potentially would be removed from the program.
Yeah, and I was going back to the original question. So you're right. Now the signage for the vaccine I did get this question this week. Someone's like, well, when am I going to get the signage for the vaccine verification? It's not in your kit, Corinne. And I said, well, it doesn't go in my kit because then anybody could have it. When you get approved, you will get your approval letter, and it literally has the link and the signage in the letter. So you will get your signage with your approval letter, and it's kind of a control method for you to make sure only those organizations that are approved get the signage. It's not out there for everybody to put up. Are there tools or information available to help encourage people to get the vaccine? And other than the mask mandate and the fully vaccinated facility program, what is being done to help bring down the case numbers?
Yeah, we have a whole team that's working on vaccination. So they are out working within the community. We have community ambassadors that are actively working to encourage vaccination, dispel myths. We have clinics that are happening, targeting specific areas like Longmont and areas where we have lower vaccination rates, trying to work with our BIPOC population where we're seeing, again, disparities and lower vaccination rates. So we have a number of efforts to try to address the vaccine area. And then that's obviously our biggest targeted tool and mitigation strategy.
Okay. So I'm actually not gonna even put this question in there. Someone was at an event last Friday with near 100 people in attendance, and at least half dozen people were sitting unmasked. What are your suggestions on how to handle as an attendee requesting that people mask in such a situation? And I'm guessing that they're saying that there weren't drinking and eating at that time, because when you're drinking and eating, you can remove your mask. But I know that that's pretty broad at that point. Maybe when they weren't drinking and eating, they weren't wearing their mask. What do you suggest an attendee do?
And I think you can bring it to the attention of the organizers. I mean, hopefully they're paying attention to that. As an organizer of an event, they should be addressing that. But ultimately, you can only control yourself and wearing your mask. And certainly, whether you continue to attend those type of events or not, and give them patronage. And you can certainly share that with our business team. We can further investigate it and reach out to the business and the organizers to make sure that they are protecting everyone.
And then there's the organizer, but there's also the facility, which is also has some control on this as well. They usually have somebody on site. So everybody's favorite holiday is coming up. Children's holiday is Halloween. What are some tips and tricks, and what is Halloween being canceled? What can you do for Halloween this year?
Well, it's fortunate that's an outdoor event for the most part, where people are going to be outside, so that's much lower risk, and not being in large crowds. Certainly, a lot of costumes facilitate having a mask of some sort potentially, but yeah, just the social distancing practices, really, keeping your distance, having minimal contact with folks. But yeah, outdoors it lowers our risk dramatically. So not going in giant crowds together where everybody's going to be in close proximity as they walk potentially from house to house, and then avoiding indoor events is going to be advisable.
And then Boulder County Public Health, if you follow them on Facebook, had a couple other tips, which are keep your guest list small and notify guests if there's any exposure, and remind guests to stay home if they're sick. If little Michael's friend is sick, don't have him go trick-or-treating with your son, because you never know. And it is outdoors. And I don't know about you, but I had a lot of fun. We put a table out in our driveway last year. Instead of people going to our door and ringing the doorbell, it made our dog a lot happier. But they came to the table and took a treat off the table, and we got to socialize with people a little bit more at a distance from our driveway. And then my doorbell was rung a lot less. But that is an alternative that people can do and keep it outside.
Yeah, I did the same.
And then a lot of churches and cities do the outdoor trunk or treats. But some are moving them back inside, so it would have to be masked at that point. So, but a lot of them have kept them outside this year. I've seen a lot of ads to keep these events outside, so I will say that's good. All right, this is a long question, so I'm going to have to give me a minute to read through it. Okay. After an event that this organization hosted, an evening masked function that they hosted, 2 weeks later, 2 people reached out to us to say their phones had been pinged as having had an exposure 14 days earlier, and both people hadn't gone anywhere else but our event. So they assumed that the exposure happened at our site. Fair enough. But we never received any notification that there was someone positive at the event. Are we just dependent on the phone notification at this point? And I'll say, I got my first phone notification last Wednesday, had it on my phone for 18 months. I got my first phone notification, and it tells you the date, and not the time of day, but the date in which it happened, that I was within close proximity to somebody.
Yeah, again, we're at a place where our contact tracing case investigation is far exceeded. So it's certainly possible for people to be out there, sometimes asymptomatic at the time, and could have spread things. But yeah, I don't know that you need to take any other specific actions other than really being on watch, that if you were potentially exposed, do that symptom check and things like that. So, but it's very possible that someone could have been at a large event and one of them could have been ill.
And they could have gotten exposed. But I went to the site, so I went to the link, and it said if you're vaccinated, you should probably get tested between these days and then watch for symptoms. But then I didn't have to quarantine. And then if I was unvaccinated, I probably should do these steps. So I did go get both a rapid and a PCR test just to be safe, because I had an event coming up as well. So I'm not sure what to do. It was my first time, with all this time with it on my phone, it was my first time getting it as well. And I didn't contact the organization, the one place I had been that day. I didn't think to even contact them because I wasn't sure what they would do about it, or if that was even an issue.
Doesn't hurt, just to share that awareness.
And people are asking, what's the app that we're talking about? And it's can you remind people what the app is?
Of the link, you probably do, Corinne. The COVID notification, you can sign up for it in Colorado, and it's using the mobility data from your phone, and then that cross-linked with people who have tested positive, and then it's going to correlate that back that you were there in the same location as a person who was ill at a time when they were potentially could have exposed you. So it's a really cool free application. And Corinne, if you haven't already,
I'll resend it. It's under settings in both Android and Apple phones. You go in and you actually just turn on the setting of exposure notifications for Colorado. And we were showing it early on. And if you were a 5-star business, you had to promote it. We'll resend it. It tells you if your phone is within 6 feet of another phone of someone who tests positive for 15 minutes, but it doesn't capture any data or anything like that. Really not, like I said, I just went and got tested, but again, it was my first time in all this time. Can you give any more information on the outbreak at the Louisville King Supers?
Yeah, I know I had reached out to our EPI folks. I know that was under investigation of is it an outbreak for sure or not, but I know that there's been a number of employees that have been reported as positives. But it's hard to always know that is acquired at work versus they acquired it somewhere else in their day-to-day life. But there have been positive cases at that facility, as have there been at other large employers too. So, but I don't have any information on that.
All right. What are the people saying about when the 5 to 11 shot will come out, and will it be a lower dose?
About the specifics of how much in the vaccine, but again, we're hoping to see that potentially before the end of this year, so ideally next month, but don't have a hard date of when that's going to be disseminated, but hope to have that out very soon.
Okay. And I don't know if you can answer this. I get this question a lot. What are the school rules around quarantine this year? When do because a lot of people that contact me are saying, but I got a notification about my kid, but then they have to quarantine. What are the rules and how is it different this year? So
it's not entirely different, but there is guidance on it's going to be an evaluation of masking and vaccination status. So there are additional factors that we didn't have last year, but all of that is posted on our website and should be available, so you can kind of walk through, but you will be notified if you have to do it versus it's up to you to voluntarily figure it out and take those steps. Oftentimes there's big blasts to let people know there was a potential exposure, but that doesn't mean immediately that you are in quarantine. So if you are subject to that based on the evaluation of proximity, masking, and vaccination status, then it will be provided to you that you do need to quarantine or not. So sometimes the schools are just doing those mass notifications. That doesn't mean everybody that received that is quarantining. They're just letting you know if you get further information, now you do have to follow that information.
Yeah, I've gotten quite a few of those at the high school. And my son, it says if he starts to develop any of these symptoms, you probably should get him tested and or keep him home. Well, if he has any of these symptoms, you need to keep him home and then test him. All right, has there been discussion between the health department and either school district on requiring vaccinations for 5 to 18?
I'm sure there's been a lot of discussions. I haven't heard of any requirement coming out, but I know that those those topics are and have been discussed at length, but I have not heard of a formal policy requiring that.
So I'm going to do last call for questions. I covered the questions that came in via email. That's why you may not have saw them come up here. They came in via email. The ones in chat, the ones in Q&A. Any additional questions for us? I had one on text. Any additional questions for Lane while we have them? And thank you. Oh, if you are an approved fully vaccinated event, will you need to apply again for the next event, correct? Let's say it's 3 months later.
So there's a couple ways to go about that. You can become a facility that's approved, or you can have each event approved. So again, it depends on how you want to pursue that. If all the events that are going to take place at a specific venue are going to follow these same protocols, you wouldn't need to get each individual event approved, versus it's going to be a mix and some events will and some events won't. Then you would need to get those individual events approved. So there's a couple ways to do it. Again, if the facility has all the policies and everybody who's going to use your facility has to follow them, that's potentially a simpler way to do it. If each individual event, you're letting them decide how they want to approach it, then each individual event would need to apply and get approved.
And then, there's the other situations where, just like we talked about the fitness, this class is going to be a vaccine only class, but this one is not. And you wear your mask until you get to that class. The office, these days are going to be vaccine only, these days are not. A rec center, the whole public area of the rec center is masked, but the behind the scenes part where the staff could be applied to be a vaccine only part of the facility. There's a lot of flexibility in this. And again, my suggestion to everybody that contacts me is apply, work with the staff, work with the contractor to see if how to make your scenario work, because your goal is not to turn people down. It's to try to get as many fully vaccinated facilities as possible out there. Okay, there are a lot of people talking about getting sued by your employees if they do not feel it is safe at work. If you have a COVID policy and enforcing masking, what more can we do? We're currently 98% and have a policy. And have a vaccine policy. And I have a masking policy.
Well, unfortunately, people can threaten to sue. So that is something that they always can threaten. That's pretty broad to say they feel unsafe at work. So if it's just strictly unsafe at work because of COVID, obviously having masking policies, vaccination policies, accommodations for staff if they don't have to physically be there and they can work remotely, those are other things that are good. Threatening to sue and having any basis for a successful lawsuit are not the same thing. So I cannot give you legal advice, but I would encourage you to reach out to your attorney or seek some legal counsel if you really feel like there might be some legitimacy to an unsafe work environment.
And check the resources we've sent to the EEOC, to the Employers Council, and some of those around what you're legally required to do. So that you're covering all your bases. Those links have been in there. The resources for businesses, they're available on the vaccine site. They're available on the state site, and I've sent them out a couple times. But EEOC and the Employers Council have a lot of great information and and they even have them in question and answer format in English and Spanish. So I think we are out of time, almost out of time, but out of questions. So we didn't go over on time. Thank you, Lane. It was a little hard to hear you at times, but I think we got all your points across.
Worried about that because that's the first time that's happened. So hope Hope nothing's happening to my laptop.
Yeah, me too. Me too.
Overuse for sure.
Yeah, lots of webinars. Thank you for your support and guidance. Was in the chat, but I wanted to say it as well. Thanks for your support and guidance. And we will see you again soon. I will again send out email with more information as it comes out, or any information, more links, more resources. Some of the resources I send out get updated information. For example, the funding link I sent to the SBDC site is a link that goes to a site that updates its resources. It is the best site out there, I know, in Boulder County with funding resources. So it's going to be updated, and it is the link that's going to go out. You know, the survey that Lane mentioned, the testing sites, the quarantine rules, I'll resend out some of the notification systems, but some of those links and resources update pretty regularly, and it's good to have them bookmarked or regularly checked. We will see people soon, and have a wonderful weekend and enjoy the cooler weather. And get your flu shot. Get your flu shot.
Yes.
Bye.
Thank you.